Eye Health TV, preventing needless blindness.
The time is 10 o'clock. Here is the news at 10 on IAPB. First, the headlines. FG pledges to improve eye care access for rural children at World Sight Day 2024. Two-thirds of Nigerians lack access to glasses, says SIGHTSAVERS on World Sight Day. Ogun State NOA. Early eye care can prevent childhood blindness and stigma. On the foreign scene, IAPB aims for global access to affordable eye care for all children by 2030. WHO highlights rising diabetic retinopathy threat in Southeast Asia on World Sight Day. WHO launches free WHO Eyes app for easy home vision testing. Now the news in details. The federal government of Nigeria has expressed concern about the continued challenge of access to quality eye care, particularly in rural communities where children are most affected. During the 2024 World Sight Day commemoration in Abuja, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali, stressed the administration's commitment to addressing these issues by implementing policies to ensure equitable access to eye care services across all regions, especially underserved areas. Represented by the Director of Special Duties, Dr. Charles, the Minister highlighted that the theme of the 2024 World Sight Day, Love Your Eyes, Kids, reflects the government's dedication to ensuring that every child in Nigeria has access to quality eye care services. With alarming global statistics showing that 450 million children suffer from untreated vision conditions, he emphasized the importance of addressing health and social disparities through eye care initiatives. A key intervention cited by the Minister is the integration of primary eye care, PEC, and primary health care, PHC, ensuring access to eye care services at the grassroots levels. The Minister also mentioned the launch of the Effective Spectacle Coverage Initiative Nigeria, Jigibola 2.0, with implementation underway in states like Rivers, Plateau, Kano, Kogi, and Katsina, and expansion plans for other states such as Ekiti, Bayelsa, and Lagos by the end of the year. Additionally, Lagos has seen the launch of a vision center under the initiative, with more centers planned to improve access to vision care across the country. The Permanent Secretary of the Ministry also reinforced the importance of prioritizing children's eye health, stating that good vision is critical for their development, education, and social interaction. Unfortunately, many children in Nigeria suffer from preventable eye vision impairments due to limited awareness and access to eye care services. Angela WHOEYES, CBN Program Coordinator, echoed similar sentiments, emphasizing that the World Sight Day provides an opportunity to focus on children's eye health and remove any stigma associated with corrective treatments like glasses. Clinton Health Access Initiative also expressed excitement in partnering with the National Eye Health Program to improve eye care, including an initiative to make reading glasses available to 5 million Nigerians. The event and speeches underscored the collective push to ensure that eye care becomes more accessible and affordable, especially for children, as part of Nigerians' border health initiatives. Country Director of SIGHTSAVERS Nigeria has emphasized that two-thirds of children and adults who have glasses to improve their vision do not have access to them. She made this statement to commemorate World Sight Day 2024, highlighting the widespread issue of untreated vision impairments. Globally, 1.1 billion people suffer from preventable or untreated vision impairments, with Nigerians facing a significant portion of these burdens. She called for improving access to eye care services for all age groups, noting that eye health is often neglected despite its impact on education, work, and independence. For this year's World Sight Day, SIGHTSAVERS is focusing on the Plateau Initiative Eye Health Program, which includes screening for several hundred pupils, teachers, education, and provision of glasses in Jos and Shandam. In addition, road shows, media engagement, and outreach initiatives aim to raise awareness at local and state levels. She further stressed that addressing vision impairment will significantly benefit the global economy, as vision correction could increase earnings and productivity. However, many people, especially in low and middle-income countries, lack access to basic eye care services such as glasses, which adversely affects the opportunity, particularly in education. The Ogun State Chapter of Nigeria Optometric Association (NOA) has advised all parents to prioritize the sight of their children for it not to be a stigma for them in the future. The association made this known on Thursday, 10th October, during the celebration of the World Sight Day 2024 in Ogun State, which was celebrated worldwide with the theme, Children Love Your Eyes. In collaboration with the Ogun State IL Committee, World Council of Optometry, WCO, African Council of Optometry, AFCO, and others, made a walk through the streets of Pansheke to orientate parents about prioritizing their children's eye health. During the walk, the state chairman of the Nigeria Optometric Association, NOA, told ILTV correspondent Kayode Jojaye that most parents can avoid blindness in their children if they take note of any irregularities in the eyes and attend to it on time by visiting the doctors.
Even the children that at least once a year we must do the regular eye check. There's so many eye problems that may not give signs and symptoms. They might be there and don't know. And then suddenly they will now manifest with sudden loss of vision. So once we do, every child should ensure that he or she will go for an eye check in a licensed clinic. You just be careful not to pronounce fast. So once every day, because the thing is that it is true regular eye check that the doctor will not diagnose those problems that you don't know they are there. And then the secret about eye care is that early detection is key to better intervention.
According to him, some parents are fond of saying children are too young to use glasses, with which they can be managing their children's eye defects, which can get worsened over time. He said if a child has a refractive error, which is one of the leading causes of blindness, and the parent refuses to attend to it, it could lead to total loss of the sight of the child. And it could also become a stigma to the child later in the future and might hinder a peaceful living for the child. He advised all parents to care for their children's eyes and theirs by visiting the eye specialist once a year to see if their eyes are in good condition. He also advised children to love their eyes by taking proper care of their eyes, by using their glasses if recommended, and also do away with anything that can affect their eyes. He gave a hand note that if any child is asked to use glasses, either corrective or any other, patients and parents should encourage them to use it, and if need be, for surgery for the child to gain a good sight, parents should endeavor to take them for the surgery, because the child's sight is more important to their future. The Managing Director of Our Health Support System, Daniel Anthony, has made a call to the government to critically look into developing and implementing an inclusive child health policy, which should be incorporated into the primary health care framework. He also urged the government to look into rehabilitation centers and also encourage the proper assessment is done in admitting students into such centers. The director made it known in a video he sent to IL television correspondent Yemi Eniola after a telephone interview during the World Sight Day 2024 celebration on Thursday, 10th October. According to him, government should ensure that children should have access to eye health care as and when needed.
Today, as we join others in the world to celebrate the 2024 World Sight Day, I want to call on our government at all levels to critically look into developing implementing an inclusive child eye health policy, which should be incorporated into our primary healthcare framework. This will ensure that our children have access to eye health care as and when needed. Another area I want us to look into is the rehabilitative centers. I want to encourage that those who run these centers should ensure that proper assessment is done in admitting students to such centers. We often experience a situation where some children who are admitted into such centers can be helped by other means, probably by a low vision assistive device and the rest. Our children deserve adequate care and we should give it. Thank you.
You also advise the children admitted into rehabilitation centers can also be helped by other means, probably by low vision assistive devices. On the foreign scene, the International Agency for the Prevention of Blindness, IAPB, has set a bold goal of ensuring affordable and accessible eye health for everyone, particularly children, by 2030. The organization is working tirelessly to prevent vision issues from undermining children's future, especially in low and middle-income countries. In an interview with the media during the World Sight Day 2024, celebrated on October 10th with the theme, Children Love Your Eyes, IAPB President Caroline Casey stated the urgent need to address childhood vision problems. She noted that over 450 million children globally require glasses, and IAPB has taken it as their mission to develop specified lenses for different age groups, with a particular focus on children this year. Casey highlighted that children in low-income countries who lack access to glasses are 2 or 5 times less likely to attend school, severely limiting their opportunities for a brighter future. She emphasized that the potential of a child's life can be hindered by not having affordable eye care.
We know that 450 million children need glasses in the world. And we also know that if a child does not have access to glasses in lower and middle income countries, they're 2 to 5 times less likely to get into a classroom. And I think people forget that the potential of a child's life and their dreams can be stopped by not having accessible or affordable eye health. So we've really honed this down to how it can be relevant to kids and how we can get excited about it too, you know? So it's kind of a few areas. One is that we're trying to get screening for kids' eye tests at schools or community centres. If you don't have eye tests, you don't know what's wrong and you don't know how you can fix it. So the first thing is to really encourage people at schools or community centres where kids gather, can we hold a screening?
To combat this, IAPB is organizing eye tests in schools worldwide to identify and address vision problems in children. She also urged optometrists globally to encourage regular eye tests and dispel the myth that seeing an eye doctor is difficult for children and adults alike. Additionally, she announced a fun initiative where children under the age of 12 are encouraged to design their own glasses, with the most creative design winning a prize of £600 for their school.
I have this cool idea, asking kids to design glasses for the future. So for children under the age of 12, they can win 600 quid for their school if they get chosen as having the most creative and wild pair of glasses. And there's nothing better than a child creating a pair of glasses that makes them feel cool. And I often say to everybody, you know, these glasses, here we go. I can't imagine how many leaders of companies or countries in the world wear glasses. And if they hadn't access to those glasses, would they be in those positions of power? I can't imagine they would. So these glasses are getting children tested so we can help them see the very best they can so they can have their very best life. I've done a huge amount in my life.
Reflecting on her own experience with eye defects due to albinism, Casey noted that 40% of children with eye diseases or defects can be treated. And she called on government, philanthropists, and eye health organizations to ensure that no child is left with unnecessary blindness. She also stated the importance of global leaders prioritizing children's eye health, noting that many of them wear glasses themselves and could not have achieved their position without proper eye care. The World Health Organization has highlighted a significant rise in the prevalence of diabetic retinopathy in the Southeast Asian region, posing a major threat to eye health. This challenge is compounded by limited access to affordable eye care, which is often provided by private sectors, making it difficult for low-income populations and vulnerable groups, such as people with disabilities and ethnic minorities, to receive necessary treatments. STIGMA Wazid, Regional Director of WHO Southeast Asia, emphasized during the World Sight Day 2024 that managing diabetic retinopathy is crucial to protect millions from vision loss and reduce the burden of health system. She also pointed out that globally, the number of children and adolescents with myopia is expected to rise by 200 million between 2000 and 2050. This is part of a larger issue with at least 2.2 billion people worldwide living with some form of vision impairment, and 30% of those affected are in Southeast Asia. WHO's regional efforts focus on targets for refractive error correction, cataract surgery, and eliminating trachoma as part of the action plan for integrated people-centered eye care. India, for instance, has made strides by eliminating trachoma as a public health problem. Introduced WHO SPEC 2030 initiative launched in May 2024, which aims to ensure that everyone who needs refractive error correction can access quality and affordable spectacles. This initiative is expected to benefit over 800 million people globally, including millions in Southeast Asia. Wazir concluded by reaffirming WHO's commitment to achieving universal eye health coverage by 2030 and addressing the barriers that prevent many from accessing essential eye care interventions such as spectacles and cataract surgeries. Also, the World Health Organization (WHO), as part of their efforts to make vision care more accessible, has introduced WHO Eyes, a free app designed to allow users to test their vision at home. The app has been validated through 3 separate research studies, and it's suitable for people aged 8 years and older. It is available in 14 languages in both iOS and Android platforms, making vision testing easy and accessible globally. The body emphasized the importance of reducing screen time and increasing outdoor activities to protect children from developing myopia. In a statement released during the 2024 World Sight Day celebration, WHO underscored the critical role that parents, caregivers, and educators play in safeguarding children's vision. They recommended regular eye and vision checks to detect any issues early. In their release, they also highlighted that restoring sight through interventions like spectacles or cataract surgery is one of the most cost-effective health interventions. However, in the WHO European region, less than 40% of individuals who could benefit from cataract surgery have received it with successful outcomes. While refractive error correction is more common, only 64% of those who need it are covered. Finally, WHO stressed the importance of adults prioritizing their own eye health by taking regular breaks from digital devices, protecting their eyes from harmful UV rays, and avoiding smoking. World Sight Day serves as a vital reminder for both children and adults to care for their vision. That was the news at 10 on IAPB. I am Angela Oluwa Fagbunbi. Thank you for joining us.
iHealth TV, preventing needless blindness.